Hello, hello. This is The Slice is Right with Dr. Aldo Guerra and
Dr. Scott Ogley. Hello, everybody. Thanks for joining us.
welcome, everyone. We're talking about some tips and hacks in plastic surgery. And our number
Exciting
one
topic.
Yeah, great topic. Our number one tip and hack is going to have to be today about nutritional supplements that can help you heal well.
Underrated, but extra important.
Yeah, underrated, but they should not be underestimated for sure. Because they
Absolutely.
definitely help. I've seen them do tremendous things. So the first supplement, we got a couple here on the table, but we're going to talk about Juven
Yeah.
exclusively today because I think it's quite useful. If you look at your screen right now, that's the orange flavor. And I'm a nice guy, and
Yeah.
I ordered the good stuff.
Yeah, good.
I did.
I'm excited.
So listen, some people might have a taste for orange, and they might love it, but fruit punch, it's preferred like 3-1 by my patients. And
yeah,
they-
that's where it's at.
they told me to be careful and order the right stuff. Yeah, for this particular show. So here's our box, and it's got some advertisement here, right? It says therapeutic nutrition powder for wound healing, right? So I'm a believer. Are you a believer,
Yeah,
Scott?
absolutely. Yeah, I think it's extra important for healing the wounds that we create.
Now, what we're going to do is we're going to talk a little bit about the product, and then we're going to mix it. We're going to try it so you guys can see that it's okay. It's not going to hurt you. It's going to actually help you. I think this one tastes particularly
Yeah,
good.
hopefully it's good too.
What's in Juven, Scott? You know all about this stuff.
Yeah, there's a bunch of stuff in Juven. It's not only protein supplementation. There's a couple grams of protein, but it has amino acids that are building blocks for new collagen production, new tissue formation, like
Nice.
scar tissue, like arginine and glutamine. And it also has some more underrated things like micronutrients, like
Yeah,
vitamin
right.
E, zinc, B12, vitamin C.
Right. Yeah, that's all the stuff that you really need to make good collagen and good scars. And, we'll go into a little bit of detail here. But, what's nice about this supplement is that you can purchase whatever whatever your doctor recommends, whatever you think you need. So most of the time, I'll tell you what I do. I tell the patients if they look like they're nutritionally well, but we're going to undergo an extensive procedure like a body lift or a tummy tuck, to get some Juven and to start 2 weeks before and end up 2 weeks after the date of the surgery. Pretty reasonable way to do it. Sometimes I do, a month and a half before and a month and a half after if they need a little bit more nutrition. But the cost of this product on Amazon, it can be delivered to your house, $75 to $82 for a 30-day package.
Yeah,
right?
not bad.
Yeah, as of April 2025. It might go up, might go down if you're seeing this in a couple of years, but I think it's a pretty reasonable price for all of the good things that it has.
Yeah, I mean, it's a good insurance policy that things are going to have the best chance of healing, and, the surgery you've invested in is going to go as smoothly as possible.
Absolutely. So some of the key building blocks, we all know that vitamin C is really needed for good wound healing. Zinc is also great for your immune system and also for that pro-collagen formation. One study that I read about Juven, I was pretty impressed with it. Turns out that, they took diabetic foot patients, which are already a challenging wound healing situation, and they were able to get, in just 2 weeks of Juven supplementation, 2/3 production of hydroxyproline, which is the precursor to collagen, okay? And that's pretty impressive that just a little bit of nutrition, 2 weeks, gets people's wounds moving in the right direction.
In
and
such a
healing.
difficult wound population, too. That's not the
Right.
wounds that we're dealing with here in this plastic surgery clinic. Those are tough wounds.
Those are really tough
So
wounds.
if we can tackle those, it can help you here at this clinic, too.
Yeah, so that's pretty impressive.
Yeah.
And then, as far as how easy is it to use, let's give it a shot. You want to mix
we
one?
gotta try it. We're preaching it. We gotta try it now.
What do you got there? You got some water already?
Water in the Botox cup. No
All right.
Botox in here, though.
So this package is the micro package. This is 8. 8, so about a week's worth. But here's yours. Here's your fruit punch. My cup here's got, there's no Valium in it actually, but
No.
it's kind of a cool cup
too
that
bad.
somebody gifted to me. It's pretty awesome. So here it is in the pack, and we're going to open it up and we're going to pour it in there. And it just reminds me of Crystal Light.
It's very similar. A little more volume.
Kind of powdery.
Yeah.
Smells really good. It looks really good. So let's pour it in there, see what color it comes out. Should be like a pink, maybe a hot pink or something.
yeah.
What do you think?
It's beautiful.
Yeah. Dr. Ogley likes it, guys. Already. Hasn't even tasted it.
It looks good. Hopefully it tastes as good as it looks, though.
All right, mine looks like a strawberry milkshake right now, but
Yeah.
I don't see any clumps or lumps. It looks like it's super easy to mix.
Yep.
Okay, you ready for the big dive?
I'm ready. Let's do it.
To your health.
Yeah, cheers.
Cheers. That's pretty good.
Yeah. It's tart, but it's...
A little tarty?
Yeah, it's
You know?
delicious.
I think it's great.
I could drink that every day, honestly. And I'm not just saying that.
Wow.
Yeah, it's really good.
Well, I didn't know it tasted this good. It's actually pretty straightforward.
So if we can do it, you can do it.
Wow, that's really good.
Yeah.
It's maybe because I didn't put enough water in the glass, it's a bit sweet for me, but I think it tastes really great.
Good. 8 ounces there.
I've never had Juven before. Have you had Juven before?
No.
Yeah. Excellent.
Yeah, very good.
So we'll just enjoy this a little bit more, but
Yeah, don't mind us.
now that we've mixed it, let's go talk a little bit about who this product really benefits, because
Yeah.
it doesn't benefit breast dogs for the most part, right? Maybe people who haven't had any weight loss surgery, but
Sure.
let's go ahead and talk about that in the next section.
Okay. Maybe not. Maybe my pre-workout.
Maybe. Pre-workout,
Yeah,
or
why
maybe
not?
one of those, like those, juicy juice, whatever those
Yeah.
are called.
No, it tastes good. Yeah. I'm not even pretending. It actually does taste good.
No, I did get the good flavor,
Yeah.
by the way. Because I
Exactly.
think there's an orange flavor that, as I mentioned, is not as preferred. But this is actually really, really good. Therapeutic nutrition powder for wound healing. So they're even telling you here that this is what you need. So I recommend it that patients, if they're in pretty good health, start 2 weeks before and 2 weeks after.
Yep.
You get 30 packets for the price that we discussed earlier. Of course, if you feel like you need more, you can take it for a month and a half before the surgery and a month and a half afterwards.
It's not going to hurt.
I don't think you're going to go wrong with
No,
it.
no,
Yeah.
absolutely not.
So, what kind of patients do you recommend Juven to, Scott?
Well, anybody with significant incisions and significant surgery sites that need healing, I think it's good supplementation. It's not going to hurt, but there are certain patients that are going to do better with them, especially massive weight loss patients. Not all massive weight loss patients are created the same either. Patients that have lost weight via a gastric bypass tend to have a little bit more nutritional deficiency because a bypass that's how it's designed. It's to be malabsorptive, so you don't absorb as much nutrition and you lose weight.
Yeah, I totally agree with that. I used to see, back in the day when I started my training 25 years ago,
Yeah.
we would tell the gastric bypass patients having a body lift, it was a 100% chance of having a wound. And with Juven, that really does go away. It's the risk of a wound
much
is
lower.
dropped down much, much lower. Yeah.
Yeah, and now we've made the push to less bypasses being performed, more weight loss patients getting stuff like gastric sleeves, which just restrict the stomach a little bit. They don't really impair your ability to absorb nutrition, and so I think we see it a lot less with those patients.
Yeah, so I agree. I don't see a lot of wound healing problems in gastric sleeve patients, not the type of patient that a gastric bypass is. Now, there is one thing that recently has come up,
Yes,
and I know you know exactly what I'm talking about, and those are those GLP-1 agonists,
like
semaglutide,
yes,
tirzepatide.
Mounjaro.
So there are some people who sort of plateau with their gastric sleeve. They may lose 70 pounds, and then they get on these GLP-1 agonists, and then they lose another 50 pounds. But we know that there's some malnutrition that's been proven to occur with GLP agonists, right? You lose 10% of your muscle mass
Yes.
on average when you're on those. So there must be some malnutrition effect, and I think that's going to be the modern plastic surgery patient who's going to really benefit from this. Gastric sleeve, GLP, or just GLP with, let's say,
Alone.
more than 50 pounds weight loss.
which is much more common even this year than last year in our practice. I think maybe 30% of patients at the minimum in our practice right now are on that. Yeah, still good.
I'm really liking this, guys. I mean, if you haven't tried this, maybe you should just do it for fun.
Part of
you
your
know?
morning routine now, maybe?
Yeah, maybe.
Okay, yeah. Maybe me too.
I don't know. I could use some glutamine in my life.
Yeah,
right?
exactly. A little bit of collagen protein as well.
Yeah, so those are really, really good points. So if you're thinking about having a body lift, a tummy tuck, a breast lift, maybe you're thinking about having a modified spiral thigh lift like we like to do here, this would be a great addition to your healing regimen. I think it'll get you through a lot faster.
Yep.
Okay, so next I think we should talk about, an actual patient experience with Juven. And we got one of my patients. So this is today's case presentation. That's going to be a new addition to all of our podcasts. At the end of the podcast, each one of us is going to get an opportunity to show a case of the week, okay? So I'll go first. Next week, Dr. Ogley's going to go and show you his amazing work. So let's put up these pictures. This is a before and after of a surgical case I did some years back, but it gives us all of the principles that we need to know. So this is a patient that had a tremendous amount of weight loss. She was 48 years old at the time, and she had lost 110 pounds after gastric sleeve surgery. And she had a tremendous amount of extra skin, as you can see. Scott, what do you think about her before? Any concerns going into surgery?
Well, a lot of excess skin, but the way that she got there through weight loss surgery would leave me concerned that she might be nutritional deficient and due to a large amount of incisions might need some supplementation beforehand.
Yeah, absolutely. Now, can we put that picture back up again? I want to... It's maybe difficult to see in the photographs, but one of the things that I see there, she has a couple of extra incisions on her abdominal wall. There's an open gallbladder surgery in the right upper quadrant. Yeah, I know it's hard to see. And then we also have another horizontal incision by the belly button on the left side of the abdomen. And I can't recall exactly what those were for, but we know that scars like that can increase the risk of wound healing. So this would be a situation where we absolutely want to have the best nutrition and optimize the patient in every which possible way. So the before and after photos are at 6 months, and we took off 18 pounds of skin and soft tissue. And we also did the muscle repair, and she looks fantastic. This lady was so happy and so thrilled. And, she also came back and did a little bit more body work on the arms and other parts of her anatomy at a later time. So that's how you know that the patient really loves her outcome with us doing an arm lift and a thigh lift later as well. So,
yeah, impressive result. It looks great.
Thank you. Yeah. Now, we have a couple of announcements here. So, as you guys know, we are looking to make you be ready, be gorgeous for the bikini season that's coming up here. So we have our bikini season promotion, which is something that we carry out every year. And you just have to go to myfaceandbody.com and look at the promotions for breast augmentation and tummy tuck that are on there right now. And, don't wait too long. Once all of our surgical slots are taken, we can't fit anybody else in. So let us know when you're ready, what you're planning, what you're thinking, and we're going to be able to help you. And we want you to take advantage of the bikini season promotions. And then we have an award winner. We have a card
speaking
winner.
of looking great in a bikini, we had our March photo challenge where we had previous patients submit photos, and we drew a winner. And our winner this month is Heidi, shown here. Heidi, congratulations! You've won a $100 gift card to Sephora. And so thank you everybody who submitted a photo. Congratulations, Heidi, for winning that. And I think we're having another one even. Is that correct?
First, I wanted to say that, that's Dr. Ogley's patient, and I've seen her before and afters, and she just looks amazing. She had a gorgeous result. He did a beautiful job. I also want to say that, we had so many people try to get this card, and if you didn't get it, that's okay. We're going to have another chance for you to submit more. So we're having an April photo challenge, and it's going on live right now, but we switched things a little bit. We're going to go with Victoria's Secret.
Okay. Still
$100.
Still great.
Which is, Sephora is very nice. I've never shopped at Sephora. Have you?
No.
Have you shopped at Victoria's Secret? Tell the truth.
Can't say that I have.
I have.
Yeah.
Yes. No, my kids, my daughters and my wife would love Sephora. Yes. But I think now as they're getting a little older, they might be more into the Victoria's Secret situation. So we have a $100 gift card for that. So be sure that you either register on our social media, at AZ Breast, or at Dr. Scott Ogley, or at Dr. Aldo Guerra. And you can find us at myfaceandbody.com as well, so that you can register. And send us your photo. We'll pick the best looking photo, the most exciting photo possible. But anyways, we want to thank you all for participating in this very educational Juven. Right? Don't leave your Juven behind. It's so easy to mix. What did that take? Like 60 seconds?
Yeah, no.
There's no clumps.
We're loving every minute of it.
No clumps or bumps. It tastes great. I would recommend this flavor.
Fruit punch.
Yeah, fruit punch. Yep. Yeah, I love it. But thanks again for your time, and we'll be seeing you next week at our Slice is Right podcast.
Cheers, everybody. Thank you.
Cheers.
Whole life's ahead of you. Can't waste it probing into the past.
We